So what does it mean to get a spine active? It's a very important thing to do. Let's find out. We say hello to Dr. Sasha Hamid joining us, associate chiropractor, Cura Vida Health Group right here in Ottawa. Hello, doctor.
Hi, Dylan. Thank you for having me back.
Good to have you back in the program. Cura Vida, 2 locations?
We do have 2 locations. We have one in the Byward Market, and the longest standing location is in the Glebe, but it has moved from 5th Avenue to a new facility, brand spanking new, on 3rd Avenue.
Okay.
Yeah.
Let's talk about some statistics here when it comes to back injury. I don't know if I know anybody who doesn't complain about back injury from one time or another. What are the stats on painful backs?
Low back pain is a leading cause of disability worldwide. It's huge. Right? So we know at least over 80% of people will complain of back pain at some point in their life, and 1 in 8 Canadians will have chronic low back pain.
Those are big numbers.
They're big numbers.
For sure. So what does it mean then? I said spine active. How do we get spine active?
Well, when we look at the world and we see the amount of people that are suffering from MSK, which is musculoskeletal pain, that includes back pain as well, but neck pain, other joints, when we see the amount of people being afflicted by these conditions, trying to stay ahead of things before they turn into an issue is much more effective. It's cheaper, it's cost effective for everyone. So staying active is a big key to avoid these kind of issues.
So then how do you, chiropractor, how do chiropractors help with this?
We try to keep it simple when we're looking at a preventative approach by just making your day harder is one of the things I had mentioned to you before.
Yeah.
So keeping active, trying to put more steps into your day. Physical activity obviously is a huge component of that. Exercise, watching how you eat, but trying to make sure that you do keep the spine mobile to prevent things that happen when we sit too long.
So it's got to be a bit of a challenge then, because you're saying people need to be more active, and sometimes people get in these sedentary jobs, sitting around all day.
Absolutely. Low back pain is a big afflictor of people missing time from work.
Okay. Now, chiropractors are a big part of Canada's healthcare team.
Yeah, so interprofessional collaboration when it comes to MSK Care is the way we are looking at treating these sorts of things today. And chiropractors can help people stay active and get them safely back to activities. We want to bring awareness to the job that we can play, giving people the right care at the right time for the right condition.
So what are some of the most common issues that you do treat?
Low back pain, for
Yeah.
sure, number 1. Neck pain, repetitive strain injuries, those sorts of things come commonly into the practice every day.
Okay. So how important is it then to treat like in advance? And when should you see a chiropractor? Because sometimes maybe it is just something that could be taken care of with some aspirin, Tylenol, something like that, or it could be a serious problem.
Right, so when we're looking at treating an issue, as chiropractors, we're looking for the root cause, right? We don't want to necessarily put a stopgap in there to cover something up. We want to try and help people get to the root cause of their issues, find out what it is, treat it, but then also give them tips and tools to prevent it from coming back. So there's a little bit of a difference there than just trying to take a pill and mask the pain away.
Yeah, that's probably never the solution, right?
Usually not, no.
Might get you through the workday, but it's going to cause other problems
Right,
down
at
the
some
road.
point you should definitely get it checked out.
Okay. So then how often should treatments happen? I guess it obviously depends on the situation, correct?
Absolutely.
Yeah.
Depends on treatment types, what kind of treatment you're going through, because when we look at MSK Care, there's definitely more than just chiropractors who can help, but depending on what you're getting treated and what's getting done, you may have a passive care component. In my field, that's more of the adjustment of what we're doing. You might have an active care component, which could be some rehab, activity, exercise prescription, but they all go hand in hand to help treat the root cause.
Sometimes people may be scared off because they think that chiropractors aren't covered.
Right.
But they are in some regards?
So, I mean, we are fee-for-service, obviously, across the province in most places, and that's how it works. But for most people that, especially in the city being an employer of civil servants, they do have extended health care coverage that could help offset some of the costs for chiropractic services.
Okay. As far as Cura Vida is concerned, I mean, you're also a massage and physio clinic, so massages must help out with some back pain?
Absolutely, soft tissue therapy helps,
Yeah.
as does physiotherapy. So again, we're looking back at trying to get an interprofessional approach to musculoskeletal health, and it's better to try and find the right people working together under one roof, and that's how we can treat our patients' needs here.
Do you need a referral from a family doctor or, say, an emergency room doctor before you go to a chiropractor?
Absolutely not.
No?
No, we're portal of entry, which means you can come in off the street, which is also why we have to be well versed in treating quite a few different things, but also screening patients to make sure that they are getting the right care in the right place.
So x-rays wouldn't be needed, anything like that in advance?
Not necessarily. Now, all chiropractors can take their own x-rays. Some facilities do have x-ray on site, as we do in our clinics, but sometimes they are helpful to try and get an accurate diagnosis, but not always necessary.
All right. Cura Vida, 2 locations, and you've just helped us get spine active. Dr. Sasha Hamid, thank you very much.
Thank you very much, Dylan.
Appreciate your time. And thank you for watching as always. Have a good day.